What is the science behind ancient healing for cancer patients? Imagine a time when doctors relied solely on what they could see and feel to treat illnesses. Ancient healing methods for cancer patients were based on observations, natural substances, and physical interventions. They aimed to control tumors and ease symptoms, even though they didn't understand the molecular makeup of cancer like we do today. These practices often combined surgery, heat application, herbal remedies, and wound care to manage tumors and related issues. Ancient surgeons used local incisions and cauterization, which means burning tissue to stop bleeding and remove abnormal growths. For example, Egyptian physicians used poultices made of soft plant materials placed near tumors, then cut into the affected area. They also used cauterization to control bleeding and remove diseased tissue. Bandages soaked in honey and grease served as protective ointments, likely to prevent infection and promote healing. They understood the importance of stopping bleeding and protecting the wound, ideas still relevant in modern wound care. Heat therapy, called hyperthermia today, was used by ancient Greeks, Romans, Egyptians, and Indian healers. They applied heat locally or to the whole body to treat masses. Heat can increase blood flow and may influence tumor cells, which is why modern hyperthermia treatments are still being explored as an addition to cancer therapy. Herbal remedies were also common. Ancient healers used plant-based substances with possible anti-inflammatory or antimicrobial effects. Traditional Chinese medicine, for instance, used various herbs, and modern research has found some compounds from these herbs, like derivatives from wormwood, that can target cancer cells in lab studies. Even though ancient treatments were based on trial and error and lacked our current understanding of cancer at the cellular level, they focused on practical aspects like controlling bleeding, reducing infection, and shrinking tumors. Some ideas, like using heat or herbal compounds, are still part of integrative therapies today. These therapies aim to support living well with cancer by combining modern medicine with safe, supportive practices inspired by traditional methods. Today, understanding these ancient approaches helps us see how humans have long sought ways to manage cancer symptoms and improve quality of life. Integrative options inspired by these practices might include heat therapy, carefully chosen herbal supplements, and wound care techniques. These are always used alongside conventional treatments to ensure safety and effectiveness. Knowing the science behind these old methods can help patients and caregivers choose supportive therapies that fit their treatment plans and personal preferences.